Hey there, my name is Sarah. I'm an employee of Vetamac Inc. Service, sales, you name it, we do it in terms of anesthesia machines. Today we're going to go over pressure testing an anesthesia machine, which is very important. Pressure testing also means leak testing. So you're pressurizing our system to make sure that we have enough pressure in the breathing head so that we can deliver anesthesia effectively and safely. And we're also going to check for leaks because we don't want to smell everybody's favorite word, isofluorane, or waste anesthetic gas, or if you're lucky, sevofluorane. So let's get to it. So first you need your oxygen on. Today we're using an oxygen concentrator. You're going to use whatever bag for your patient. So we got a tiny bag today, but we also have an adult Y circuit, that's W-Y-E, not W-H-Y, question mark, W-Y-E. And then we also have your F circuit. So depending on what you use, they're gonna work the same way. Okay? So we'll just do our Y circuit. Okay? First things first, if you have an elbow on any of these circuits, please take it off, because remember, we want a leak test. And if something is leaking, we want to make sure that we're isolating. So removing anything that can possibly leak is a great start. So we're going to take these off. And your occlusion valve too. So we'll get to that in a minute, but this has an integrated occlusion on that pop-off valve, but we'll get there in a minute. So your circuit, your bag. Bag goes on the breathing port. Your circuits go on the inspiratory and expiratory ports. If you have some sort of a plug, that would be ideal because you want a complete seal, but other ways, use your hand. I use my thumb. I have rather small thumbs. Even extra large thumbs have a hard time with this seal, so you're gonna have some sort of tolerance, okay? Here at Vetamac, we actually pressure or leak test up to 30 centimeters of water instead of what a lot of practices will use 20 centimeters of water of holding pressure. There is a reason for that, especially if you're using an occlusion valve, because your occlusion valve will actually leak at 20 centimeters of water, so we don't want that. What we're gonna do for a proper leak test, you have to close the pop-off valve. Do not use your occlusion valves. This particular one, that's your occlusion valve. And then the other ones that stick out, which many are used to, that's your occlusion valve. That's really not a way to properly leak test. You can, there are many different ways. This is the way I'm going to teach you guys today. You're going to occlude the end of the circuit with your thumb, plug, whatever you want to do, as tight as possible. Then what you're going to do, well, let me close this to 0. The oxygen concentrator may scream because it needs to be on, but for the purposes of this, we're going to close our pop-off valve. That is closed. We're going to open our flow. You see how it's rising. Rising, rising, rising on our manometer. You're going to hit 30, then you're going to close your flow. See that? On your flow meter. It should hold at 30 centimeters of water. If it drops significantly, you have a leak somewhere. Right now, you got a wonderful hold. Next thing, please open your pop-off valve first. Why? For safety. So at least we know that that step is taken care of. And then you'll let go. And that is how you leak test an anesthesia machine.